My name is John Kiluk. I'm a surgical oncologist at the Center for Women's Oncology here at Moffitt. Moffitt's breast program is very special in my mind. It's set up with the focus on the patient. If you notice our offices, there's a medical oncologist right next to a surgeon, which is next to a pathologist, which is next to plastic surgeons. And I think so much in medicine, the surgeons and the oncologists and the radiation doctors are all separated. But here at Moffitt, all of our goals are the same. And I've never encountered a center where our offices are all together, where we all talk together. And that's very important to me as a surgeon, because what I do as a surgeon has direct implications on what an oncologist does, what a radiation doctor does. And that communication is very important between all the specialties. I love my job in that I really get to know a patient. I meet someone at potentially the worst time of their life, and I'm able to guide them through this very difficult time and get through it together and get to know a patient over several years. You feel that it's not just a doctor-patient relationship. It's actually more a friend-friend relationship that develops over several years. And that relationship is priceless. When it comes to practicing medicine here at Moffitt, I think one thing that's very unique about this institution is that all that we do within our program is breast cancer. It's been 5 years since I've taken out a gallbladder. And that's really nice, and that all the surgeons, all the oncologists, the radiation doctors, the radiologists, their whole focus is on breast cancer. And with that amount of volume that we get, that creates an unparalleled experience for the clinician. The journey through breast cancer is a very emotional journey. When I talk to my patients years after, most patients liken it to the loss of a relative or friend. And if you think back at your own experiences when you lost someone you truly cared for, there are a whole range of emotions: shock, being upset, anger. And so for that reason, it's a very emotional time. And when you draw the parallel to breast cancer, the whole range of emotions is identical. There's no right or wrong with how a patient should act. I think it's very important that a patient is free to express their emotions. I think the one thing I always stress to my patients is that the only thing they ever need to know when they meet us for the first time is that we're going to be with them all the way through this process. That's the only thing they need to know.